Cancer. September, this month, is the time to talk about it, to raise awareness and spread information. More than 43,000 new cases are going to be diagnosed this year. So I've got Dr. Christopher Dyas here with some important information from Infirmary Health. Thank you for stopping by.
You're very welcome.
I know
Thanks for
you're
having me.
normally in the operating room, so this is out of your comfort zone, but we appreciate you stopping here.
Very much so.
All right. Well, talking about thyroid cancer, and let's start with the diagnosis.
Okay. Well, typically someone will either feel a nodule in their neck, or their physician will find a nodule in the patient's neck, and we go through the diagnosis, and usually start with good history and physical. Have they had radiation in the past to their head and neck? That's not as common now as it used to be, but radiation to the head and neck was used in years gone by to treat acne, and not knowing that the consequences could be the development of papillary carcinoma of the thyroid. So that's part of the history. And then the physical exam, do you feel anything? Are they experiencing any voice changes or soreness in their neck, and can you feel a nodule on the physical exam? And once you find a nodule, then we need to go into the diagnosis. What is this nodule? Is it a cancer, or is it benign? And the first step usually is an ultrasound of the thyroid.
Now, what causes an issue with your thyroid to lead to cancer?
Well, once again, the most common thing that in the past that's beyond just genetics would be the external radiation.
I see.
And so,
okay. And so after you have that treatment, then you have to continue treatment once you get the surgery, right? Then there's other treatment. Can you talk about that?
Well, we kind of skipped a step. The treatment is taking out the thyroid, the cancer, and staging it at that point. And then many times they're followed up with radioactive iodine to complete any cell, to kill any cells that may be left behind. And then we monitor the possible recurrence of the thyroid cancer by lab tests and follow-up ultrasounds of the neck.
Now, we were speaking, off camera here. Sometimes this can be common, thyroid cancers, and they're not always an issue, but there are cases that can be more severe.
Right. Well, the three main types of cancer, fortunately two of the three main are the most common, are papillary and follicular carcinomas. But the most deadly type is anaplastic carcinoma. And fortunately it's the least common, but it's very aggressive, and it starts as a nodule, it grows rapidly, it invades the surrounding tissues quickly, and it spreads to the other parts of the body pretty quickly. And
as with anything, if you notice something that's off, get it checked out.
Absolutely. Get it checked out. Go to your primary care physician, or directly to your surgeon or your endocrinologist, because treatment of thyroid cancer is really a multimodal thing. You have the endocrinologist, the surgeon, the radiology department, and the pathology department.
All right. Well, thank you. I'm going to call you Dr. Chris. Is that okay?
You can call me anything you want.
Okay. Well, thank you for stopping by.
Happy to be here.